Hey there, welcome back to GrowMed. In this video, we will discuss about some important diseases which you must know. So, in a single go, we will be discussing about the PYQs, then the important questions which were asked, and also what all you must read for the future exams. So, everything like the disease, the diagnosis, the pathogenesis, everything. So, it'll help you in the last minute revision, and it'll be like a small video, a quick video of some 10-15 minutes, so you can watch this video in your break time also. So without wasting much time, let's discuss. And the part 1 video of this one is already uploaded. So we have discussed about the retinoblastoma. Short question, 1 marks you can expect from this, and the questions have been asked from these only. Around the questions will be like surrounding these things only. Then uh, myasthenia gravis also discussed, pheochromocytoma, carcinoid, acrodermatitis, and Wilson. So from this you can surely expect some 2 or 3 questions for sure, and from this video you can also expect some 2-3 questions. Okay, so let's discuss the Merkel's diverticula, an important topic from the surgery. So the things which you must remember is that it is a true diverticula and it is a congenital. So congenital, and it is also the most common congenital anomaly of the midgut. So one liner is being asked on this. Then it is single and it is anti-mesenteric border. So there was a question asked in the past year that all of the following statements are true about the Merkel's diverticula except, and they had given it is a true, it is a congenital cause, it is a single, and it was mesenteric border. So it is not mesenteric, it is anti-mesenteric border. Okay, so a question was asked on this also. Then the cause, this one is a must to know, like frequently questions have been asked on this one. So the cause, of the Michael's diverticula is that persistent omphalomysenteric duct or vitellointestinal duct. So if you go into the embryology, this is the foregut. This one is the embryo, this is the foregut. So as there is less space present in the fetus, so this bowel comes out of the fetus and it rotates like clockwise, anti-clockwise, 90 degree, 90 degree, like this it rotates and it grows. Then after some weeks it will go in back into the body, and this one will be closed. Okay, but in some cases what happens is this defect will not be closed. So persistent omphallomesenteric duct or vitellointestinal duct of the embryo, if these are not closed, then this defect can occur. So the Merkel's diverticula. Okay, so I think you've understood the pathology behind this. Now let's look at the clinical features. So if the ectopic mucosa is present, then it will be presenting as the bleeding and pain abdomen. And investigation of choice is the technetium per technique scan, PYQ, it was asked. And they can also describe the clinical cases, and this image is also important because image based question have been also asked on this. They'll give the image and they'll ask what is the diagnosis. Okay, so this technetium per technique. Then investigation of choice for the diagnosis is uh, enteroclysis. Okay, for the diagnosis for the ectopic mucosa, it is a technetium per technique scan. So whichever is given in the options, you will be choosing that one. Okay, then treatment, how do you treat it? So if the base is healthy, then diverticulopexy plus anastomosis, and if base is unhealthy, then resection plus anastomosis. So this is the treatment option available for it, and it is popularly known as rule of 2 because it is seen most commonly in 2% of population. It is 2 inch and 2 feet proximal and seen in less than 2 years. Okay, so rule of 2. So these are the things which you must remember. So 1 PYQ, 2, 3, 4, 4 PYQs you have been discussed on this Merkel's diverticula, and image based question also. Then moving on to the gist. So gastrointestinal stromal tumors, again an important topic, and this was a PYQ asked that what will be the location or arises from the pacemaker cells, and this is the interstitial cells of the Casal. So this was the PYQ asked that just arises from which of the following cells. Then speaking about the marker is the keratin. So this was asked in the integration with the pathology. So in patho they had asked this what will be the marker. Then location, stomach is the most common location, and clinical features that it is an extramural growth. So let me do it. If this is a stomach, then there will be some extra growth like this present here. This one is called as the gist, and bleeding will be there and abdominal pain also will be there. Then it will spread hematogenous spread to the liver. So whenever in GIT, where whichever disease is causing some hematogenous spread, no, it will be first most commonly going to the liver. So metastasize to the liver most commonly. Okay. Then investigation of choice, CECT, PYQ, and treatment is this wedge shaped resection excision. So this was asked as a PYQ. They had described the a patient who is having GIST. So which of the following treatment you will be doing it? So wedge shaped excision. This was asked in the exam. Okay. Then moving on to the thyroglossal cyst, again an important topic, and surely you can expect one question in the upcoming exam also. So by breaking the name only, we can come to know what is the exactly the pathology behind it. Thyro means involving the thyroid, glossal involving the tongue, and it is a cyst. So the classical thing which will be described in the exam in the case is that moves with the deglutination or moves up on trunk protrusion. So whenever you see these two things described in the case, blindly go with the thyroglossal cyst as the answer. So it is also a congenital cause, but it is seen in 15 to 30-year-old, like congenital in the sense it doesn't present like in 1 to 2 year, or doesn't present congenitally. It will take some time to present. Then it is a midline swelling in the anterior part of the neck. Then so it will be in the case given as midline swelling in anterior part of the neck. And site, most common site, this is also PYQ. So this was asked that which is the most common site for the thyroglossal cyst. So it is a subhyoid location. Then complication, so again a PYQ. So this was also asked that complications. So whenever there's infection of this cyst, there will be formation of the abscess, and in the abscess, when we do incision and drainage, there is a risk of developing thyroglossal fistula. Okay, so thyroglossal fistula is not occurring by its own, we are triggering it to occur. Okay, so remember it like that, thyroglossal cyst, when it all this is present, it's not that risky, but if it turns into the thyroglossal fistula, it will become risky. Okay, and it increases the risk of the papillary cancer. So treatment of choice is cyst trunk operation, so PYQ. And frequently questions are asked on this thyroglossal cyst, either the image, so this image will be given and they'll ask what is the diagnosis, or something like this. A patient, 15-year-old patient, will come with the midline anterior swelling, complain of moving on deglutination, and something like this will be described. So what will be the diagnosis? It will be the thyroglossal cyst. Then they can ask what will be the treatment of choice, so cyst trunk operation. Okay. Then so what is the cyst trunk operation? It is the en bloc removal of the central part of the body of hyoid bone and cyst. Okay. Then congenital diaphragmatic hernia, again a repeat topic. One question surely you can expect from this one question. So congenital diaphragmatic hernia, so this is the uh, location where it will be occurring. So left side, most commonly left side, and posterolateral. Then the pathology, why does it occur? So due to the failure of the fusion of the pleuroperitoneal canal. Okay. Then the intestinal organs are herniated into the chest, the spleen, stomach, transverse colon herniate. Okay, these herniate into the stomach, as you can see here in the image also quite important. Frequently image based question are asked on this. So see here on the lung, this side you can see multiple air fluid levels suggestive of the bowel present in the chest area, and this you can see here that the lung is pushed towards the other side. Okay. Then the triad which is present is the respiratory distress, dextrocardia, and the scaphoid abdomen. Dextrocardia in the sense heart will be present to the right side because it is pushed to the right side. That's why. Okay. And respiratory distress because the lungs are also collapsed. The lungs are also pushed towards the side. So there will be respiratory distress. And the scaphoid abdomen because all the organs have been herniated into the stomach, right? So the abdomen will be empty. So whenever you see the child lying, you can see, appreciate that the abdomen has gone something like this, the scaphoid abdomen. Okay. Then on chest x-ray, you can see bowel loops and multiple gastric bubbles in the thorax, this one. And the coiling of the Rayleigh tube occurs in the thorax. Okay, so coiling of the Rayleigh tube in the thorax. Then management is reduce the herniated organs and close the defect. So these are the things which you must remember for the congenital diaphragmatic hernia. Then the last we'll discuss about two important diseases, pediatric conditions, the acute epiglottitis and the croup. Again, you can expect one question from either of the one. Okay, so the causative organisms are also important, and acute epiglottitis, so streptococcus pneumonia, and for croup it is parainfluenza or haemophilus influenza. This is a quite controversial question, so there have been various multiple updates regarding this one. So do have a idea about this, please look at it once again, that which is the causative organism for the croup. Okay, so it is a controversial question. Then the features of the acute epiglottitis, the patient will be having fever, sore throat, dysphagia and dyspnea. And investigation of choice is the chest x-ray. You can see the thumb sign on the chest x-ray. So this sign, thumb sign, this is called as chest x-ray. So image based question can also be asked. You just give the image and the this sign is seen in which of the following disease. So it is the acute epiglottitis, and treatment is the ceftriaxone, which is the drug of choice, PYQ, and steroid nebulization. Okay, so this was all about the acute epiglottitis. Now about the croup, which is also called as acute laryngeal tracheobronchitis, and clinical features are the biphasic stridor is seen, then fever and barking cough. Then investigation of choice is the steeple sign. So you can see here, this is the steeple sign. Steeple sign in the sense the church, the, if at all you have seen the church, you know, they will be having some these uh, signs present, so steeple like, so these are called as a steeple sign here. And treatment is the humidified O2 steroids and the bronchodilator. So PYQ, they had asked a question on this group that all of the following are used as a treatment for group except something like this, and these were described in the case. Okay, so investigation of choice, then thumb sign, then steeple sign, then the clinical features and the causative organisms, all these are important. So yes, that's all in this video, and from this you can surely expect some 2 or 3 questions in the upcoming exam, both for the NEET PG as well as the FMGE. So thank you so much for watching this video. For the PDF, join my Telegram channel, and for more amazing stuff related to the FMG, subscribe to Chromed and follow me. Thank you so much. Bye bye.